lagging behind with boosters. San Francisco County health officials are launching a new initiative today, urging seniors to get vaccinated before the holidays. ABC 7 News reporter Stephanie Sierra is digging into some of the data that's out there. She is in the newsroom tonight with a closer look. Steph?
Yes, Dan. While boosters for Moderna and Johnson & Johnson's vaccine got approved just over a week ago, it's been more than a month now since the FDA authorized Pfizer's booster for seniors and those at high risk of COVID. But health officials say both groups in San Francisco are far from where they need to be.
For months, we've heard health officials highlight the importance of booster shots, especially for seniors and those at high risk of COVID-19. But the problem in San Francisco, most aren't getting them.
Only about 1 in 5 of our seniors over 65 have gotten boosters, or about 19%.
Deputy Director of Health, Dr. Navina Baba, says these are people who are eligible, meaning anyone 65 and older who are at least 6 months out from their primary vaccination series.
Where would you expect that percentage to be?
It's a good question. I mean, obviously, we would want it to, especially as we go into the winter months, we want, those percentages to be, well above 50%.
San Francisco has more than 100 vaccination sites across the city and county, including health centers, pharmacies, and hospital systems. Yet Dr. Baba says many of them saw little demand for a third dose over the past few weeks.
Yeah, I think it was like at a steady low level, just in vaccines in general.
Why do you think that is?
I think there's a couple reasons. I mean, first of all, it was only Pfizer that was approved. Luckily, Moderna and Johnson & Johnson have also now gotten approved. And so I think because of that messaging, people weren't quite sure if they should get a booster.
The critical third dose now considered necessary as research on waning immunity becomes more clear.
The research is showing that, months out, immunity might even decrease below 30 to 60%. I mean, there's a range there.
Dr. Mike Wasserman, who sits on California's Vaccine Advisory Committee, says educating people on the value of boosters will be critical for us to move forward.
If we don't spend the time and energy to educate, we're going to be down the same path. People just aren't going to naturally do it. We cannot assume that they're just going to say, great, the booster's here.
And now that they are here, with the holidays inching closer, we all have a deadline to meet.
And what I would encourage everybody to do is look at Thanksgiving, go back 2 weeks and say that's when you want that's your deadline for getting a booster.
All right, so 2 weeks out from Thanksgiving is November 11th, which is just a couple weeks away. So, Dan, I'd say a pretty easy deadline to meet, given there are plenty of booster appointments available online. In fact, I just checked a moment ago. You can go to sf.gov/vaccine sites to find a clinic near you. And, of course, we have that link over on our website as well.
All right, thanks, Stephanie. And before you go, what did the doctors say about the thinking behind why some seniors have not gotten their booster yet? Why?
Well, Dr. Baba pointed to mixed messaging on boosters when the FDA and CDC were not on the same page. It certainly created some confusion. So she thinks that could partially be to blame here, but also added, some people haven't been tracking their 6-month timetable from when they've finished their vaccination series. You've got to remember those vaccination cards and take a look at them again. It's a good reminder to keep tabs on that. And when you are eligible or if you feel at risk, to go ahead and get one.
Absolutely. Stephanie Sierra. Thanks, Stephanie.